Emcure is coming together with Symbiosis University Hospital and Research Center, along with Symbiosis College of Nursing, for Emvidya Nursing Training Academy, a knowledge enhancement series. This series is specially designed for your nursing and paramedic staff. A 12-month series which will cover various mother and child care modules like antenatal care, labor process, postnatal care. It is a one-of-a-kind series which will help you better your knowledge, problem-solving skills and commitment to patient advocacy. Each module is meticulously prepared by the experts at Symbiosis University Hospital and Research Center. Learn and interact with the best.
Away from the hustle bustle of Pune, in the quieter environment of Lavre stands the majestic campus of Symbiosis University Hospital and Research Center, SUHRC, a retreat hospital. Sprawled over 40 acres, the hospital campus houses an 866-bedded multi-speciality hospital with over 20 specialties. For over 50 years, Symbiosis has been imparting quality education to students across the globe. Drawing strength from this trust, Symbiosis University Hospital aims to redefine healthcare in Pune through its evidence-based clinical care. Taking forward the philosophy of Vasudhaiv Kutumbakam, the world is one family, SUHRC believes in inclusiveness across all strata.
At the Symbiosis University Hospital, our goal is to provide the best of patient care through our team of well-trained healthcare professionals, supported by the latest technology and excellent infrastructure.
We have specialists in cardiology, nephrology, neurology, gastroenterology, and other surgical specialties. SUHRC offers comprehensive care to patients through a full spectrum of medical and surgical services with the latest state-of-art equipment. At Symbiosis University Hospital, our endeavor is to send back happy patients by creating a homely environment by going beyond the call of our duty and thus have happy faces, smiling faces at home and in the hospital as well. At SUHRC, healthcare goes beyond infrastructure and facilities. We make qualitative difference to one's life and health through patient-centric approach. It is beyond call of duty for all of us. SUHRC, one family, one hospital.
Symbiosis College of Nursing is in the very beautiful campus of Lovely with SUHRC Hospital above the College of Nursing. The Symbiosis College of Nursing was commissioned in the year 2007 with the goal of preparing global nurses and placing them across the world with one philosophy of symbiosis, that is, world is one family, Vasudhaiva Kutumbakam. The college is spread across 39,424 square feet with all the facilities of labs and classrooms. Technology, the latest skill facilities have been provided in Symbiosis College of Nursing. The Symbiosis College of Nursing is manned by a very well qualified nurses handpicked through a very stringent recruitment process. Symbiosis College of Nursing proudly presents 12 faculty members who are pursuing their PhD at this point in time, with 4 PhD members already on the board. And the Symbiosis College of Nursing prepares nurses in the lab and thereafter in the parent hospital, that is Symbiosis University Hospital and Research Center. So have a big bandwidth of international students. Strives hard day by day to give a wonderful nursing care both in the hospital as well as in the community. Symbiosis College of Nursing will always strive to do the best that can be done for the patients and the families in the community, thereby coming with a tender, loving care of nursing.
A very good afternoon to everyone. I, Shona Fernandez from Emcure Pharmaceuticals Limited, take this opportunity to welcome all of you for the concluding session of Emvidya. This unique initiative by Emcure in association with Symbiosis University Hospital and Research Center and Symbiosis College of Nursing has covered over 3,500 nursing homes and nursing and paramedic staff across India. In this 12-month knowledge enhancement series, we have covered comprehensive topics on mother and child care, and it has been a memorable journey with all of you. The topic for today is postnatal period, doctor's perspective. And we have eminent doctors with us, Dr. Khushali Ratra, Dr. Omkar Swami, Director Medical Services, Emcure, Dr. Kedar Tambe, Head of Marketing and Corporate Wellness, SUHRC, and Dr. Sonupan Joshi, Principal, Symbiosis College of Nursing, and Dr. Jyotsna Podar, Professor, Symbiosis Medical College of Women with us. We thank SUHRC and SCON for developing such a wonderful program to train and empower nurses across the country. With this, I would like to invite Dr. Khushali Ratra, Dr. Swami, Dr. Sonupan Joshi, and Dr. Kedar to say a few words. Ma'am, Dr. Ratra, thank you so much for being here.
Thanks, Sona. Thanks so much. So, yes, it's been a 12
months of one wonderful journey, which we were unaware of when we initially probably started our discussion. And it unfolded to be a very fruitful journey, probably for the nurses who are trained across the country. We had a lot of, I think, interactions in the initial phase. But the best part was that what was aimed at has been achieved at the end of the sessions of 1 year session. And I think we should look forward to more such specialty trainings, because that is what is needed at the smaller nursing homes, or maybe the A&M nurses which are there. And that will be really empowering the nursing care across the country. So we will definitely like to further grow into other arena of Emvidya. I mean, Dr. Omkar visited us, Dr. Sunapan Joshi before, Dr. Sharda Ramesh was there. But whatever said and done, what ends well is all well. So it did go on well, and I congratulate Emcure for starting this initiative. We would definitely like to take it ahead further.
Thank you, ma'am.
Thank you. So, ma'am, on behalf of Emcure, we are very much thankful to you. As you rightly mentioned, we have started this journey maybe of 12 to 15 months advance, because a lot of things have also gone into the conceptualization of this program, designing the program, finalizing the topics, and addressing the need of the larger audience who is across the country, who have not access to that kind of knowledge sharing sessions regularly. We have seen a lot of webinars happening for the doctors, but not actually for the nursing staffs where it is required. So that was the another intention from our side to initiate this program, and it was truly very memorable journey. More than 12 months, we have every month we used to have a session by a senior faculty from Symbiosis College of Nursing, and they used to take a very practical topic. It's not related to more of theoretical, but more of practical, which address the needs of the nursing staff. So that was the intention, and and we really look forward, ma'am. So this is a beginning. We look forward to stay together for further training courses as well. So that will be really helpful for the society, for the what you call as my colleague Shona has mentioned, more than 3,500 nursing hospitals or the nursing units are participating in this program regularly. So that speaks out the success of this program. So we really look forward for this kind of sessions again in our next year as well. Thank you. Thank you very much.
Thank you, Shona, and thank you, Dr. Swami, for this. I've been part of a small part of this, to and fro's, and I really appreciate the Emcure team who connected to all corners of India, all nursing homes, all consultants, through them to nurses from all walks of life, and it was really path-breaking, I could say, because we get a lot of calls and a lot of sisters from probably all parts of India and abroad to some extent also have joined and taken help for this. So let's strengthen this joint venture and look forward for more such ventures in a more planned manner. And so hearty congratulations to all your team, entire team, Dr. Swami, Dr. Shona, I think Dr. Kaveri is there, yeah, and our entire team, Prezi, Jijo, Imran, and the entire faculty of Dr. Sonopan Joshi, really appreciating that they had tough times at times at COVID and working from home and many such and parallel faculty work for their college and so on, but they managed the module well, and it was very practical session for all the nurses, and we had a very good feedback, and so congrats again. So let's keep up this joint venture. Thank you.
Thank you, Dr. Kedar.
Dr. Joshi?
Yes, sir. I am there.
Yeah, could you please have a word?
Yes. Good afternoon, one and all these eminent personalities from the Emcure, Dr. Kushali, Dr. Kedar, Shona, particularly, she was very very active and instrumental in the conducting and just coordinating all these programs, along with some faculty from the Symbiosis College of Nursing, some faculty from the SUHRC. And we are also equally happy that we have got such an opportunity to impart knowledge to the nurses. And initially, when the planning was done for this program, Dr. Sharda was there, and she has made such a wonderful module for the nurses by referring the multiple books and experts and all. And see, similar kind of program should be there. See, we know that because the nurses are the major portion of the healthcare delivery system. And one weakness of the this healthcare delivery system is nurses means there is no continuing education program for the nurses. Because see, this health science, particularly health science, medical science, nursing science, is a dynamic. It is not a stable. Once the training is taken by the nurse and throughout life she will work, it will not happen like this, because always the skills are changing, knowledge are changing, some medicine is changing, equipments are changing. Now, initially it was a face-to-face nursing was there. Nowadays it is an online program, this technology, everything is on the technology, but nurses are not well versed with. So, I have some discussion with the government nurses from the Sassoon Hospital staff nurses. They are telling, even being a government nurses, we do not have any formal training after the basic training. So this Emcure has taken the very good initiative, and they have done for the nurses. And it's not only for the state of Maharashtra, it is across the India, and more than, I think, 15,000 nurses at a time were attending the sessions. It was really wonderful. And I have taken the inspiration from this, and we have developed a multiple such modules, like a COVID module we have developed, we have implemented 2 batches we have conducted. We have a critical care nursing module, we have an orthopedic module, we have this dialysis module, and now for the nursing student, I am developing some universal human values module. Because they, along with the knowledge part, they should have some moral responsibilities, that softness, politeness, communication skill. So that also has to be there in the nursing module. And I'm very happy, and I congratulate this Emcure and the entire team of the Emcure that they have developed such a program, and I hope they will continue on the various such a program. And see, I wanted to tell you one suggestion. So as short as possible, this module should be, because nowadays, see, nurses are very, there is acute shortage of nurses, because hospital is not able to spare them for the formal program like 1 month, 2 months, 3 months. So this Emcure model, how the Emcure model has done every Saturday or every Sunday like this program, and very short duration, and then we can inculcate all this knowledge and we can give the certification to them. And another thing, the nurses should be motivated, because what happened, even though nurses are getting some additional knowledge, they are not getting the incentives as such. So for their additional knowledge, or for example, we are since 10 years we are conducting the critical care nursing program along with the Dinanath Mangeshkar Hospital and our own networking nurses. But after the completing this diploma or the certification program, so the nurses are not getting any incentives. So we can just have, because we are not the authority for the hospital and all, but at least we can suggest, we can recommend such a somewhat the incentives. And even even the remote nurses like ANM, ASHA workers, Anganwadi workers, they also should be trained in their own components, because they are also deprived of the education. And recently, I am planning now that we have a tie-up with the Indian Academy of Pediatrics, and we are developing some neonatal resuscitation program. And I'm now giving to the remote area by going into the PHCs and going into the sub-center. We are conducting some training for this ASHA workers and ANMs. So thank you very much for the entire fraternity of this program. And I thank our hospital authorities and the Emcure authorities for such opportunities. And I hope they will continue in the future also. Thank you so much.
Thank you, sir. Thank you all our eminent doctors for your.
So now I want to make a comment to what Dr. Joshi said. I mean, one thing I think which he rightly said, and which is the need of the art for the nurses, is definitely we need to empower them, and that empowerment will come only by communication. So a module of nursing leadership administration should definitely be looked into, because that's going to be the key going forward. If we can work, that's going to be adding to their value.
Sure,
we all focus on only the clinical part of it, but there is a lot of other things. If they have 4 relatives, they don't know what to do. So that's where it's going to be important.
Points well taken. Soft skills are critical and important in current era.
Yes.
Not only the soft skills, communication and the soft skills. That's very important. We will definitely look forward. We also look forward important point which is raised by Professor Joshi sir, that the modules needs to be short and sweet. So that's also we will look forward. If we can look forward, it should be short and a crisp, so that the more people, and there will be a lot of topics also we can undertake. Points well appreciated.
Very relevant points by all of you. So thank you so much for these pearls of wisdom and these inputs from all of you. With this, very quickly now, I would like to hand over the session to Dr. Kaveri to introduce our eminent speaker from Symbiosis, Dr. Jyotsna Poddar. Over to you, Dr. Kaveri.
Thank you very much, Ms. Sona. Hope my screen is visible.
Yes.
I take this opportunity to welcome today's eminent speaker, Dr. Jyotsna Poddar. Ma'am is MBBS MD and in obstetric and gynecology. Ma'am had done diploma in laparoscopy and hysteroscopy at Kiel in Germany and colposcopy at Arcon London. Ma'am is doing private practice since 1987 at Poddar Hospital, Pune Hospital and Deen Dayal Hospital. She joined as assistant professor at Srimati Kashibai Naule Medical College and promoted to professor in 2018. She joined as a professor at Symbiosis Medical College for Women in 2019. She has presented papers in national conferences and published many papers in Indian Journal. She has conducted 25 courses on colposcopy for oncosurgeon, obstetrician, and gynecologist. I welcome Dr. Jyotsna ma'am, and I request ma'am to please start the session.
Thank you very much. I hope you can hear me.
Yes, ma'am.
Yeah. Okay. So my topic is postnatal period with doctor's perspective. So postnatal period begins from the expulsion of placenta to the period of 6 weeks after that. Okay. So I would be dealing with nursing care in the labor room, shifting from labor room to the wards, obstetric ward. This will be my priority. And after that, the discharge of the patient, follow up the patient, and at 6 weeks, ensuring that the woman has reached the status of normalcy after the delivery, which may be a cesarean, forceps, vacuum, or a normal delivery or vaginal delivery. Now, the change that occurs after the placenta is delivered, what we expect as a nursing assistant who's available with us is the drip is already going. It may be having 5 unit of Pitocin or lesser unit 2.5 unit of Pitocin should be upstage to 20 units. 500 ml of Rinvolactate with 20 units of Pitocin, it should run fast so that the uterus retracts well and the bleeding is reduced. Immediately, if the obstetrician thinks that the uterus is not well retracted, it is atonic, needs more of help from uterine contractions, ask history of asthma from the patient. That is very important. Give Carboprost 250 microgram, which has to be loaded from the refrigerator and given intramuscularly. Right? Then the obstetrician expects a trolley, which will have 2 SIMS retractors, 3 sponge holders, lot of gauze, lot of pads, so that women can be cleaned, washed with Savlon or betadine, whatever is the routine in that hospital, and explore the cervix if she thinks or he thinks that there is a cervical tear. So the nursing will be helping, the nurse will be helping during the exploration and helping with the trolley. Once the cervix is explored, if required, if there is a cervical tear, one may require suturing. Depending on the liking of the obstetrician, you will have to give Vicryl Rapide or Cadmet. With the needle holder, plain forceps, after the suturing is done, the obstetrician may require a roller gauze. One of the problems these days we face is the roller gauze is not available in the delivery kit. Actually, newer nurses don't even know what a roller gauze is. So a well-made roller gauze where the pieces of the gauze piece are not projecting out should be available there, so that if needed, if some kind of packing is needed, it can be done. Next thing is, none of the refrigerator has the ice. The ice packs which are given to preserve any of the Cerviprime gel or these tablets, injectables, Carboprost, are basically very large ones. If there is expected to be an episiotomy hematoma or anywhere we want to put an ice pack, we need ice from the refrigerator, the freezer of the refrigerator. None of these are filled and kept ready for an emergency. So it is very important that the nursing in charge or the nurse on duty in the labor room ensures that these trays are filled with water and the ice is ready at the time of delivery. Okay. Now, after all this has been done, one must ensure that aseptic cleaning of the patient's vulva, vagina, episiotomy is done, proper antibiotic cream is applied, a clean, sterile pad is given, and then the patient is allowed to rest for some time. If it is a normal vaginal delivery or forceps or vacuum, if no anesthesia was given, she can be offered some warm liquid before she is shifted out. Now, we are going to observe this patient in the labor room or in the obstetric ward immediately or postnatal ward immediately next to the labor room for another 2 hours, where we want to see that the uterus, is it becoming atonic again? Is the episiotomy painful? Is there an episiotomy hematoma? Or is the patient able to pass urine? Plus, if her blood pressure was high, is it still high or it needs to be controlled? If there is hypertension, then that needs to be looked into. So very crucial time, every 15 minutes, the vitals need to be seen. And in the vitals, one must look at her face. Is she sweating? Is there rigor? Is there chill? Is there fever? Fever up to 38 degrees centigrade after delivery for next 24 hours is considered as normal, because we sometimes give misoprostol to control the hemorrhage, which itself causes fever. So you need to look after all those things after delivery. Then you have to see whether there is pallor. Sometimes the bleeding will collect in the uterus. She may not bleed outside, but when you look at the pallor in the patient, the eyes looking sunken, there is sweating, the pulse is steady, BP is falling, you know that there is bleeding inside, and immediately you call the obstetrician so that the uterus can be explored, clots can be removed, and if there is some tear which has been missed, which can be looked into. Okay, so this is very important. Then woman is going to be extremely tired after this ordeal of vaginal delivery, and that is the time when there is need of physical, mental, and psychological help to the woman. Now, sometimes you need to shift the patient after you have observed her that there is no PPH, there is no problem, she has passed urine, there is no retention of urine, there are no paraurethral tears, uterus is well retracted, and this is the time you decide with the consultation from the obstetrician that the patient can be shifted. It is very important. Just don't tell the lady who is looking after the sweeping and all to shift the patient alone. The patient needs to be shifted on the trolley with the help of the sister who is in charge of the labor room, so that all the falls and all can be prevented and patient is not hurt. Okay. Similarly, at the time when you're shifting the mother, the baby needs to be shifted, and the baby should also be checked for reflexes, color, grunting, whether the baby is breathing well. Immediately after vaginal delivery, one can give the baby to the breast and you have observed whether the baby has suckled well or no. Post-cesarean section, only what you have to look is pallor, pulse BP, pulse ox, uterus whether well retracted or no, how much is the bleeding. And then the patient can be shifted from the labor room to the ward. Now, this shifting of the patient from labor room to the ward is extremely important. On the way, things can go wrong, and therefore somebody who's good at diagnosing problems in the patient must go with the patient. It should not be taken very lightly. Okay. Now, once the patient reaches the ward, now the ward sister is responsible for looking after the patient the moment patient lies down on the bed. Her face should be looked at. Is the patient looking weak? Is the patient looking sweating? Is the patient showing signs of shock, breathlessness? Her pulse, BP, pulse ox, uterine size must be looked for. Now, one must remember that after delivery, the uterus will be at the umbilicus, right? It should be well retracted and the bleeding should be less. The episiotomy should look normal. It should not look swollen. These are the things one must look for. She should have passed urine by this time. If you have been given handover that the patient has not passed urine, one may need to give her a lot of fluids. It may be that she has not had enough of liquids to pass urine. You should ensure that the hydration is there, pulse BP is normal, and you have taken her to the washroom, encouraged her to pass urine. If she has not still, one may need to catheterize the patient under all aseptic precautions. Then you must see the patient every 4 hours once the patient is settled. And in this 4 hours time, you have to again look in the eyes for pallor, for uterus, look at how she is breathing. Is there any discharge from the nose? Chest, are there any rhonchi? You must examine the size of the uterus. Now, the uterus must invigorate 1.25 centimeters per day. So for that, you have to take symphyso-fundal height of the uterus in centimeters with a tape. And this should be recorded. This will let you know that there is something collecting inside the uterus. One must smell the lochia. It is very important because of foul smelling lochia. What is lochia? Lochia is the discharge which comes out of the uterus after the delivery for next 14 days. And if there is foul smell, there is infection, and there may be endometritis and sepsis and septic shock. So it is very important. Sometimes the discharge is very less, still there can be infection. One must ensure that she uses sterile sanitary napkins, and the baby has to be with the mother. Baby must get breastfeeding every 2 hours. And the colostrum, which is produced immediately after delivery, is extremely good for the baby. After breastfeeding, one must ensure the baby is burped. So all these, the nursing help is going to help a lot the patient. Now, we have already discussed how the vitals of the patient needs to be done, because if she is hypotensive, you need to find out. If she is hypertensive, you need to find out. If there is tachycardia, if there is bradycardia, all these need to be done. And any finding that is abnormal, you need to inform the obstetrician. Breast care is very important. The nipples, if they are dry, should be properly lubricated, washed with soap and water. Patient should be taught how to do hand hygiene, how to wear a mask, how to keep distance in COVID times, how to breastfeed the baby with care. And every time she breastfeeds, all these 3 precautions need to be taken. Laboratory testing is already done when she is pregnant. Blood group, CBC, urine microscopy, but CBC and urine microscopy will help you tell if some anemia has occurred after delivery, which needs to be treated. We have already discussed that this is the first day, and we need to look at these things on the first most crucial day, that is the day after the delivery. Cleanliness of episiotomy wound is extremely important. You must look at the episiotomy 3 times a day. One must ensure that with dilute Savlon needs to be made. In the shops, the Savlon that is available needs to be diluted 3 to 5 times in sterile water. And then you need to give the wash, dry it, apply antibiotic cream. Stool softeners in presence of episiotomy help a lot, because one do not want the patient to have pain when she is passing motion. Cleanliness while passing motion is very important, and the advice regarding sexual activity is going to come at the time of discharge. Breast care, we have already talked about how the nipple care needs to be done. If the nipples are retracted, then syringe can be used to pull out the nipple after cutting the tip of the syringe. Breast pumps will also help, and even 2 fingers help these breasts. Diagnosing engorged breasts is very important. Whenever you go towards the patient, you must, with her permission, palpate the breast and see whether they are getting harder. If they are getting engorged, they need to be emptied. Sometimes pitocin helps by giving the let down. You can request the obstetrician to come and see, ensure that the breasts are regularly emptied. Now, postpartum depression is extremely common. This is because of the fatigue of the vaginal delivery. After that, sleeplessness. See, the baby is being fed every 2 hours. After that, the baby passes urine, motion, is cleaned again and again, breastfed. So most of the time, patient is sleepless. The help is not enough. The help which they get is not enough for them to relax, and therefore they become depressed. And therefore it is very important to train the relatives to help her in such a way that she gets to sleep at least 2 hours at a go. And anytime depression is noticed, the obstetrician should be informed so that proper care can be taken. Then pain management is very important. One must ensure that proper analgesics which are suitable to the patients are given in proper doses. And now comes the time for contraceptive counseling. Now, it is very important to tell the patient that she can get pregnant even if she has not had her periods after 1.5 months of delivery, because the ovulation starts. And what we believe in, that the lactational amenorrhea, whenever she is exclusively breastfeeding, she cannot get pregnant. It's not that simple. There are many women who come and meet us at 3 months of delivery, 4 months of delivery, cesarean section, when they are already pregnant, and then it becomes very difficult. So it is very important to give them proper contraceptive advice. It is the choice of the patient. She may use a barrier contraception, she can use a depot, she can use a copper T. Copper T can be inserted immediately after delivery and during the antenatal period. When she comes for booking, that is the time when she needs to be talked to which type of contraception she wants, whether she wants to have a temporary contraception or permanent. And if she needs to have a tubal ligation, then she needs to be told. And this baby, immediately after delivery, we are not able to tell what is the prognosis of the baby in due course of time, and it will be her decision that she goes for a tubal ligation. Now again, we have talked about, as in vaginal delivery, cesarean section also, all these points need to be seen. Oral resumption is taken within 6 hours. Pain and management is extremely important, and ambulation. It does not mean if the patient has had a cesarean, she cannot move about. After the catheter is removed, the Holy tip should be sent for culture sensitivity. Patient should be encouraged to pass urine after 2 hours, not immediately after Foley's catheter is removed. She must be encouraged to have lots of liquids. Breast care need to be done. Stitch line needs to be looked at. Look for temperature rise, warm skin, maintain hygiene. Look for local smell. Look at the uterus where it is. Here again, you have to take a symphysis fundal height to know whether the involution is happening or no. Contraceptive counseling we have already talked about. Now, dietary supplements come once her antibiotic, painkiller, local antibiotic creams are over. There is no need to start in a hurry iron and calcium while she's in the wards itself. You can give this at the time of discharge. That is the time when antibiotics have been stopped. So iron and calcium need to be given for 3 months after the delivery. There will be special cases where there was intrauterine death, where more psychological support, counseling, how we can prevent IUD next time. You need to stop the breast milk and therefore a cabergoline needs to be given. The painful breast need to be helped with ice pack, tight braces to prevent breast engorgement. Now, women who have pregnancy-induced hypertension will be given magnesium sulfate in the labor room, and we need to continue in the wards, and one must ensure that gluteal abscess does not occur when Maxell was given IM. If she's receiving IV infusion, then infusion pump must be looked after well. Her urine output should be maintained. One must look for tender reflexes and respiratory rate. Baby care is very important. Once the mother is having very high blood pressure, the baby care has to be by the relatives or the sister who's on duty. Regular BP monitoring needs to be done and proper drugs need to be given. And reconvulsion need to be prevented. Crash cart is to be ready with the intubation trolley and antidote, calcium gluconate. The diabetic mother will need regular blood sugar levels. Her diet has to be diabetic. Insulin dosage need to be accurately decided and given. And whenever there is hypoglycemia, we have to manage it with glucon powder or 25% dextrose transfusion, depending on how much is the hypoglycemia. One must prevent infection by keeping the area dry, clean, and antibiotics. One must remember that in asthma, we cannot give carboprost, and therefore history of asthma should always be mentioned. Whenever there is PPH, one may need to give carboprost, and asthma should be excluded. Injection hydrocortisone will help relieve asthma. Infectious diseases like chicken pox can happen in the mother at the time of admission, or she may come with chicken pox. In that case, one need to maintain isolation. Adequate dressing and breast milk expression need to be done. Anti-D has to be given to a woman who is Rh negative and the baby is Rh positive within 72 hours of delivery. That's all from the PowerPoint presentation. If you have any questions, IT, SHRC, can you look at the chat box? If there are any questions, then we can answer those.
Yes, ma'am. There are few questions in the RX platform. First question is how to manage breastfeeding if there is pregnancy-induced diabetes to mother?
There is no difference, absolutely. Diabetics don't have problem with breastfeeding. They will breastfeed the baby as in any other normal patient.
Madam, thank you very much. This is Dr. Swami. Thank you very much for a very illustrative and encompassing all the aspects of postnatal care, and sometimes and it's very critical and important. Postnatal care is a critical part of in the mother's life. So we also appreciate and understand. Ma'am, I just want to ask you one for the larger audience. What kind of a dietary, you mentioned calcium and iron is required, but what kind of a dietary modifications are required in a postnatal period for the mother?
Mother requires nutrition in which the calories should be, adequate calories should be there, adequate protein should be available, and all the nutritive elements that are present as antioxidants, vitamins, which we get from leafy vegetables, fruit vegetables, dals. If she is a non-vegetarian, then boiled egg and chapatis and fruits, milk. All this will give adequate diet to the patient. And most of the times, good hospitals or most of the hospitals may have a dietitian who can advise, like we recommend a high protein diet to any woman who's anemic, or so like that nutrition can be met.
Madam, you also very nicely touch upon very important aspect of a mental health, and most commonly postnatal depression is also seen in the mothers. So how to identify as a nursing staff, how one can identify this patient is having a postnatal, what you call as a depression? And you have also mentioned some of the aspect like talking to them and some care that also you mentioned, but how to identify or how to, which patients are high risk for this kind of
whenever the nursing staff goes for rounds, one must talk to the patient. When you talk to the patient, you will realize that she may have a staring look. She may not be taking care of the baby the way normally women take. She may look listless. She may not be taking care of her looks. Sometimes she may not be well dressed, may not be keeping herself clean. She may be having episodes of crying. She may start, behaving like a small baby, so that you understand that something is wrong. And she may not eat well. She may argue with people around her. So one must keep antennae high to understand that yes, she's having a problem. And especially when the woman has been awake the whole night, she may complain of headache. She may tie some handkerchief around her head. So you know that this woman is having depression. She may have crying spells also, which will tell us that there is a problem.
Another very important aspect, ma'am, slightly, when you also touched upon your lecture about the contraception. So how early in a postnatal period we should advise the, there should be a counseling for the contraception for the couple or for the female?
Actually, we recommend that during antenatal period only, they should be talked about, the contraception, because post-placental property is inserted immediately after delivery. Therefore, this should be done in antenatal period. And if it was not done, or even if it was done and she has refused a post-placental property, then we can talk to her once she is comfortable, shifted to the ward, well rested. If she has not slept the whole night and we start talking at night 2 a.m. that she should be using contraception, she's not going to listen. So when she's well rested, we can talk about it. We can have special counselors, nursing counselors who can talk to her about barrier contraception. When they can start sex, like usually 6 weeks is recommended, and this after 6 weeks, there are more chances of her getting pregnant. So it is very important that she understands that barrier contraception injection depot. She can insert a property after 1.5 months. There are progesterone only pills that are available, which can be started, which do not reduce the amount of milk. And she can choose or a permanent method of sterilization, whatever she chooses, in which even the husband can take part, like vasectomy can also be.
Another important point, ma'am, in India, we all know the prevalence of anemia and iron deficiency anemia is quite high. And the pregnant woman after the delivery, those who are in a postnatal period, so what kind of iron you usually recommend, and how long that iron should be recommended?
Yes. So usually we see the hemoglobin of the patient after delivery. If it is around 11, then we give routine single tablet of iron tablet, any iron tablet. Okay. It could be ferrous sulfate, ferrous fumarate, ferrous sucrose, or anything.
Even ferrous ascorbate.
Ascorbate. Now, if it was hemoglobin is between 9 to 10, that is the time our action begins. We give them double dose, ensure that she doesn't get constipated, doesn't get acid peptic disease or any kind of problem, and we follow up. If she complains of any problem, then actually women prefer taking IV iron. And as we know that Orofer S as well as FCM, both are easily available nowadays. And we can postpartum to single shot, one go, we are capable of covering up the postpartum period. Otherwise, we give it for 3 months to 6 months, these iron tablets.
Okay. Thank you, ma'am. Thank you. I think these are the questions from my side. I thought these are the practical things all people should understand. That's why I've asked. Kaveri, if you have any questions in the chat box, you can take up with madam.
Yes, there is one more question from audience. Pregnancy-induced blood pressure and diabetes comes in pregnancy time, but it will continue throughout life or it will disappear, ma'am?
Yeah. So first it was thought that it will disappear, but no. This tells you that you are more prone to develop diabetes and hypertension in later life. But there is a good news. If you have a good lifestyle, you can delay it. Say you were going to get after 10 years of delivery, if you have good lifestyle, good exercise, healthy food, then you may delay it for another 20 years or even 30 years. But you are more prone than the general population to get hypertension and diabetes in future life.
Thank you, ma'am. We have also got comments as good and scientific session. Thank you very much for enlightening us. No more questions now. Okay, so.
So I think thanks, ma'am, for taking a very important topic and critical topic of postnatal period. So this was our concluding session, and it is very nice, ma'am. You grace the occasion. You come here and you join the meeting and give us important talk. I think, Shona, we can proceed for the conclusion of this session.
Yes, definitely. Thank you, ma'am, for your session and your presentation. I think we can conclude. We thank you for explaining very comprehensively the postnatal period. I'm sure it will help our paramedic and nursing staff to understand this important period and handle complications. We would like to thank all our faculty speakers, coordinators from Symbiosis and from Emcure, and from Symbiosis, especially Mr. Imran Ali. We would like to very specially thank all our participants for taking out time and attending this session and being a part of our Emvidya program. So thank you so much. Before we end, we would just like to tell our participants that their certificates are there on the link on RX platforms. So they can just click on it and get the certificate. Also, to please share your feedback with us, on the feedback poll. We would appreciate your feedback. And with this, I think we can conclude. So thank you very much to everyone. And thank you, Dr. Swami. Thank you, Dr. Podar, especially for being here with us. And thank you, Dr. Ratra, especially for being here motivating us.
Thank you.
Thank you.
Thank you, Dr. Kaveri.
Thank you.
Thank you.